County officials say they've seen far too many pedestrian deaths in our area and something needs to change. Today, the Kern County Board of Supervisors heard the proposal to fix the problem. Eyewitness News reporter Kristen Powers tells us that plan. Kristen?
Rochelle, pedestrian safety is a constant issue around Kern County, and the Board of Supervisors seem to be addressing it head on.
This discussion is obviously very important, but even more so this morning as there were 2 more fatalities that occurred over this last weekend in Oildale.
A joint response from Kern County Public Health and Public Works addressing a request from the Board of Supervisors.
In the board letter,
their task is to analyze pedestrian and bicycle accidents and deaths in our community. Figure out why it keeps happening and what can be done to stop it.
In particular, you requested we evaluate environmental conditions, including street lighting and time of day of the accident, and if the pedestrian was in a crosswalk.
Public Health Director Matt Constantine says they did that, and today they're rolling out an interactive online map that plots data for incidents going back 10 years.
Showing the high-risk areas
where people get hit the most.
We can tell you that there's areas in Oildale and East Bakersfield that suffer disproportionately from higher rates of accidents between pedestrians and vehicles.
So far, the data is only coming from CHP, but the county hopes to compile information from Bakersfield Police and Caltrans.
This is very, very exciting.
When looking at solutions, county officials say it's a mixture of creating safer roads, awareness, and education. Constantine says right now they're looking at starting up a big awareness campaign. The idea is to put more billboards around the most dangerous areas, place advertising on get buses, and do PSAs for radio and TV.
Shouldn't we make a driver aware that there could be those that are walking out because maybe the sidewalks aren't developed or aren't easily accessible?
The entire campaign would cost about $90,000. Funding the county still needs to find.
There was some discussion about grants on the longer term, but we're interested in making some shorter term solutions, so we'll have to put our heads together and find it.
The board is now asking Public Health to do some more analysis on the best way to move forward. They'll bring the findings back to another meeting, but at this point we don't have an exact timeline. Reporting in the studio, I'm Kristen Powers, Eyewitness News. Dave, back to you.